Respiratory therapy, Lesson 4, Pre-use inspection of the ventilator. This unit will cover the basics of respiratory therapy. The goal for this lesson is to understand the types of ventilator inspections and learn about the items to inspect before using the ventilator. This is the content of this lesson. First of all, inspection of a ventilator can be broadly divided into two types: periodic inspection and daily inspection. Periodic inspections can be outsourced to a medical equipment repairer or performed by a medical institution. In either case, the inspection must be performed at least once a year and the inspection records must be kept by the medical institution. The daily inspection can be divided into pre-use inspection, in-use inspection, and after-use inspection. In this lesson, we will go over the pre-use inspection as part of daily inspections. The pre-use inspection consists of the items 1 to 5. Those items are categorized into either visual inspection or operational inspection. This lesson covers the inspection items for a typical ventilator. For the details of actual inspection items for each ventilator, make sure to refer to instruction manuals issued by each manufacturer. The first part of the pre-use inspection is a visual inspection of the physical condition of the device. Check the entire unit for any damaged parts, and also for looseness if there are any connection parts. Frequently reported troubles include monitor screen errors, loose connections between the gas hose and the main unit, and crushed operation switches. The second part is to ensure that all preparations are in order before use. Make sure the device is connected to an emergency power source, and confirm that the power supply and gas lines are connected properly. As a precaution, it is important to pull and check the pipelines to make sure they will not come loose, as they can be blown off by pressure due to connection looseness. The third part is the self-test of the device. The self-test is performed each time the device is turned on. The device performs tests on CPU, indicator lights, and audio on itself. The user must manually check and ensure that all the indicator lights and alarms function properly while running the test. The fourth part is the leak test, in which the device checks for leaks in the circuit installed in the ventilator. Like the self-test, this feature is pre-installed in all ventilators. In addition to detecting a leak, some devices may reflect the circuit compliance value by measuring the resistance of the circuit. The last part is the operation check. Operate the ventilator with a test lung, and visually check whether or not the air goes into the lungs and the ventilation synchronizes with spontaneous breathing. Also, check the operation of the alarms in the same way and see if they work properly. Once the operation check is completed, the ventilator is ready for use. It is important to have the ventilator ready for immediate use because the patients in need of mechanical ventilation are usually in critical conditions. However, it is also important to perform a pre-use inspection thoroughly to ensure safe use of the device. This is the end of Lesson 4, Pre-use inspection of the ventilator. Make sure you've mastered the basic concepts before you move on to the next level.